This is an anniversary we'd certainly rather not be marking. Since the first case of COVID-19 was confirmed in Canada 1 year ago, public health experts have repeatedly told us this is a marathon, not a sprint. But even marathons have a finish line. This virus has always been a step ahead of us. Eric Sorensen reflects on a year of COVID in Canada.
It was the first presumptive case of COVID-19 in Canada. A man returning from Wuhan, China, was hospitalized at Toronto's Sunnybrook Hospital.
The patient was detected and immediately put in isolation.
But could COVID health and government officials have been more tightly bunched to talk about it? How little we knew then of the coming threat.
The risk to Ontarians is still low, and things are managed and well controlled.
For weeks, it seemed well controlled. There were very few cases, but Canadians continued to travel carefree, still gathered in huge crowds, and were told there was seldom a need for masks in public.
What we worry about is actually the potential negative aspects of wearing masks.
This mask is a wonderful example of this.
This epidemiologist says advice evolved over time on masks from limited to widespread use, but it's not evidence that science got it wrong.
It's completely acceptable to modify your opinion based on new information. That's how science works. Like, you modify your opinion based on fact and based on emerging data.
Canada has advised Canadians to curtail non-essential international travel.
By the time the country began to lock down last March, the response was remarkable. Governments at all levels and most Canadians readily accepted a dramatic shutdown in their lives. But over time, businesses reopened. Canadians began to gather again. The virus was able to make a comeback over and over.
We should have known that that was coming, because every time we have had a holiday, civic holiday, or anything which encouraged gatherings to occur, we always saw cases increase.
Governments, say experts, have not done enough to keep the virus in check, with better tools to screen in schools and with sufficient testing and contact tracing.
The plan should have been, we lock down, you drive the case numbers down to something reasonable, and you deploy extraordinary public health assets to keep the numbers simmering at a low level. Backwards contact tracing, you find the source of the outbreak. And on top of that, rapid testing.
Now we're facing a new threat, much like we did a year ago. New COVID variants being discovered so far in small numbers. But this year we won't have the excuse that we don't understand it and didn't see it coming. Eric Sorensen, Global News, Toronto.